I want to speak to the abortion access portion of the bill. I want to do it humbly and sensitively. It's not an easy issue. It's a near statistical certainty that someone in this room has had an abortion. I am in no position to judge anyone, and that's not my intent. I do think the legislature needs to have a better conversation about public policy in the state when it comes to abortion, because not on an individual level, on a macro level, we have a state that now 61,000 abortions in a year represents about 39% of our pregnancies in New Jersey in a year. We have about 100,000 live births in the state. 61,000 abortions means we're aborting about 39 to 40% of our kids in the state. And that's a tragedy. And, you know, the Assemblywoman came up and talked about these beautiful lives that are being ruined. But these are healthy, innocent, beautiful babies who don't get the opportunity to live. And that's a tragedy. Not any individual. Again, I don't want to talk about any individual circumstance. But as a state, what are we doing? I mean, why do we have... Abortion has grown 25% in New Jersey in the last 5 years. That's a statistic from the Guttmacher Institute. The national abortion rate rose 11% this time. We've more than doubled the national rate in increase. We don't have an abortion access problem in New Jersey. We have an abortion overuse problem in New Jersey. And why aren't we talking about why it is that so many New Jerseyans feel compelled to make that choice? Why don't we try to make it easier for moms to have their babies, as opposed to having a state where 39–40% of our babies are aborted, and we have passing legislation to increase abortion access? Isn't that a problem? Isn't it a problem that a black woman in New Jersey is 4 times as likely to have an abortion as a white woman? That's a problem. Why aren't we addressing those issues? Let the record reflect. I'm not bringing up the abortion issue. The Democrats are. The majority can't stay away from this issue. But when we bring these issues up, this is about abortion access, Madam Chair, and I'm on the bill. This isn't. Listen. This is one of the reasons people who are concerned about their First Amendment rights, because when you don't like what people start to say, you try to quiet them. This is an abortion access bill. I don't understand why you're so determined to expand abortion access when we have statistics like that, which indicate to us that we are overusing that procedure. So, I said I'm going to say this humbly and respectfully, but I sincerely hope that sometime soon the legislature will change the topic of conversation, or change the focus, and figure out how we save individuals' lives instead of terminating. So I vote no.